Recently, there has been a news that has become viral. The world famous pop singer Justin Bieber has said that he is suffering from Ramsay-Hunt syndrome, and according to him, it's caused by a viral infection. And since then, there has been many articles written over Ramsay-Hunt syndrome. But being medical, it's very important to know the actual facts about this disease and what are the important things that you should know, which can come in your upcoming exams as well. Before explaining the Ramsay-Hunt syndrome, let me explain this in a chronological manner, how the disease or what is the pathophysiology of this disease in a patient. So let's talk about chickenpox infection first of all. So chickenpox infection, most of us are already aware about this disease since our childhood, because I have been infected by chickenpox and also my friends, and I suppose many of you as well. The causative organism of chickenpox infection is varicella zoster virus, which is also called human herpes virus 3, HHV3. This is very important thing to remember, and all other details that are mentioned here are also very important to remember. So the rash can be itchy, painful, but the important fact to remember about the rash is the rash in chickenpox infection is symmetrical. It's bilaterally present. And also the spread of the rash or the pustules or the spots of chickenpox is in a centripetal manner, meaning it starts with the trunk and then it starts to spread out to the face and limbs and legs. So this is starting from the center and then going in a centripetal manner. It's called centripetal way of distribution, and it's important to remember because there can be another question where it will be mentioned like there are spots on the body of a baby in a centrifugal manner. So whenever you hear a centrifugal manner, the centrifugal is associated with the smallpox infection, where the pustules or the rashes starts from the face, then limbs, and then later it goes down to the trunk. So being a viral infection, the chickenpox in childhood stays for about 10 to 15 days and then it goes away and we all live normally. But sometimes the viral agent causing this chickenpox stays inside our body in a latent phase. Latent phase meaning it is asymptomatic and we are not even aware about it, that it's still inside our body and it's not completely eliminated from ourselves. And if we'll talk about the location where this virus, the HHV3 virus resides, it's in the dorsal root ganglion of spinal nerves or cranial nerves. And it stays there for years since it's in the latent phase. But whenever the patient gets into an immune suppressed state, maybe because of the HIV infection, which is the most common infection causing immunosuppression, and also if the patient is taking steroids or immunosuppressive therapy, this latent virus may start to reactivate. And this reactivation of this HHV3 virus presents as shingles. So whenever you hear shingles, it's very important you do not confuse it with other maculopapular rash or the type of pustules or blisters. Shingles are basically another word for belt. So whenever we call shingles, it means spread of anything in this manner. So it's always unilateral and along a dermatome. And this shingle itself is also known as herpes zoster virus, which is actually not the name of the virus, but it's the name of this condition when the virus is reactivated and it spreads in this shingle manner. The terms herpes zoster are taken from Latin origin, where the herpes means to creep and zoster means the girdle or the belt area. So always we will find this herpes zoster in a unilateral spread along a dermatome, and that's obviously because, as I have already told you, the virus resides in the dorsal ganglion or spinal or cranial nerves. So when it reactivates, it starts to involve that nerve and the nerve that is supplying the dermatome. So that are the areas that are involved. So if the spread is along the umbilicus, it will be T10, and if it's along the chest or thoracic area, it will be T4 involvement. And these rash will be pustular, red, erythematous, and also painful and very itchy, and actually very painful. The patient will be crying in pain and irritation, like what's going on, and it's very disturbing situation for a patient. So this was the pathophysiology, the basics of this herpes zoster infection or herpes zoster virus or shingles. Now let's welcome the elephant in the room, that is Ramsay-Hunt syndrome. So what is Justin Bieber actually suffering from? As I told you, the spread is along a nerve. So whenever there is involvement of a geniculate ganglion that is present in the middle ear, external ear, middle ear, inner ear. So the middle ear, there is geniculate ganglion present. When the infection or the reactivation of herpes zoster occurs there, then the involvement starting with the facial nerve, because the facial nerve, geniculate ganglion acts as a nucleus for facial motor nerve. So there will be lower motor nerve palsy, so which is also called LMN palsy. And when there is LMN palsy, there will be complete paralysis of half of the face, and it will be ipsilateral to the nerve involvement. It's very hard to control the muscles of the face, and basically the facial nerve, the cranial nerve 7th, is involved. The clinical presentation of the patient will be, there will be pustules over the ear pinna and also along this spread where the facial nerve is actually supplying. And in this condition, if it's acutely present in a patient, so first of all, steroids are prescribed in a low dose so that the inflammation or the involvement of the nerve is reduced, or the acuteness of the condition is, controlled. And the basic treatment of choice otherwise is antiviral drugs, which is acyclovir. So acyclovir is prescribed to the patient. Now let's learn another fact. Just to push this knowledge a bit further, let's talk about the herpes zoster ophthalmicus. So Ramsay-Hunt syndrome is also known as herpes zoster oticus. Now we will learn about herpes zoster ophthalmicus. Whenever there is involvement of the rash or the nerve starting from the tip of the nose, so tip of the nose, the nerve here supplying is the nasociliary nerve. So when this nerve is involved, the spread is along this area, as you can see in this image. So this will be the spread, and also this nasociliary nerve supply the cornea and the conjunctiva of the eye. So there will be a conjunctivitis, and things like that, the eye complications. The treatment will be same, so there is no any different treatment for herpes zoster infection. So that was all. So whenever any non-medico friend of yours ask you about what has happened to Justin Bieber, now I guess you have something to explain them, or what he is suffering from. So in my opinion, it's very important to, whenever this or any medical condition has been highlighted, or any celebrity has encountered any disease or any condition, it's very important to read that thing on that very spot or at that very moment, because it kind of gets imprinted in your brain as you associated with this with a person. You associated this disease with a person. Every time you hear Justin Bieber song, next time you will remember, yeah, there was Ramsay-Hunt syndrome, and what was Ramsay-Hunt syndrome, and step by step you will start to remember or recall everything about this disease. So if you have any other interesting case that you want should be highlighted or should be discussed, write down in the comment, like this video and subscribe to the channel, and leave your suggestions in the comments. Thank you. Hey, wait, I forgot to tell you, recently I have created a Telegram group. So if you have anything you want to discuss with me or within the group with the other medicos, the link is down below in the description. You can talk to me personally on Telegram, and also you can also follow me on Instagram. That's also below in the description. So we'll see you there also. Take care and bye bye.